This video summarizes residual volume of extruded disc material and residual spinal cord compression measured on postoperative MRI. Do not predict neurological outcomes in dogs following decompressive surgery for thoracolumbar intervertebral disc extrusion. Going through the introduction. Intervertebral disc extrusion, IVDE, occurs when degenerated nucleus pulposus material herniates into the vertebral canal. This causes spinal cord compression, leading to various clinical signs ranging from thoracolumbar pain to plegia and loss of nociception. Surgical decompression is the most effective treatment for severe clinical signs and when medical management fails. Different grading systems have been developed to evaluate treatment efficacy and prognostic indicators preoperatively. Surgical treatment is considered successful when urinary and fecal continence is regained, and ability to ambulate unsupported is achieved, or when neurological grade improves. Although recurrence rate is rare, 0% to 1.3% of cases may need a second surgery at the same site. MRI is the current standard for diagnosis and surgical planning for IVDE, T2-weighted spinal cord hyperintensities, and the length of attenuation of the cerebrospinal fluid column on HAST SSFSE sequences are studied and correlated with outcomes. However, SE hyperintensities on T2W sequences are not specific findings. No objective criteria have been reported in published studies that correlate postoperative residual SE compression or volume of residual extradural material with outcome. This study aimed to determine the prevalence and the volume of residual extradural material, VREM, and residual maximal spinal cord compression, RSCC, on postoperative MRI of dogs with IVDE. The hypothesis was that residual extradural material would be present in 100% of the cases, and its volume would represent about 20% of the preoperative extradural material volume. The second hypothesis was that RSCC and VREM measures would differ between neurological outcome groups. For the methods, this retrospective, analytical study examined dogs who underwent surgical management for an acute thoracolumbar intervertebral disc extrusion, IVDE, at the University of Montreal between 2010 and 2021. All dogs had pre- and postoperative MRI and a complete neurological examination before and after surgery. The study was approved by the animal owners, and MRI studies were reviewed by independent observers who were blinded to patient information and outcome. The study aimed to identify factors that may influence the outcome of IVDE surgery, such as spinal cord compression SCC and residual extradural material REM. The pre-surgical MRI examination was performed the same day as the surgery, and the postoperative MRI was performed within 24 hours of the surgery. Each MRI study included a minimum of 2 DT2W pre-contrast images in sagittal and transverse planes. The decision to perform a postoperative MRI was either systematic, based on personal preferences, or based upon a specific request from the surgeon. A consensus was made between an ACVR-certified veterinary radiologist, an ACVIM-certified neurologist, and a veterinary diagnostic imaging intern to determine subject inclusion. Age, sex, breed, body weight, duration of clinical signs, and surgical technique used were obtained from medical records. Anonymized and randomized MRI studies were independently reviewed by 2 observers, with residual spinal cord compression, RSCC, defined as the ratio of the area of the SE at the intervertebral disc space of maximal compression to the area of the SE at the closest normal intervertebral disc space. The volume of REM was calculated based on visible extradural material postoperatively. A neurological score was attributed to each case pre- and postoperatively based on the neurological examination data on admission and at follow-up. Dogs were classified into the positive outcome PO group if a lower neurological score was recorded postoperatively compared with preoperatively. Dogs were classified into the negative outcome NO group if the postoperative neurological score was identical or higher. Statistical analysis was performed to evaluate the influence of age, body weight, duration of clinical signs, and surgical technique on the 4 parameters: preoperative SCC, REM, RSCC, and percentage of decompression of the SC after surgery. General linear models were utilized to evaluate the effect of these factors and postoperative SCC decompression on the outcome. Interobserver intraclass correlation coefficients were used to evaluate the interobserver variability. Going through the results, the statistical analysis included 17 cases, comprising of 10 dachshunds, 2 Shih Tzu, 1 French Bulldog, 1 Maltese, 1 Pomeranian, 1 American Cocker, and 1 Chihuahua. Out of these, 16 cases were considered potentially chondrodystrophic and were castrated males, while 1 case was a spayed female. They had a mean age of 6.2 plus or minus 2.0 years old, and a mean weight of 7.4 plus or minus 2.9 kilograms. 65% of dogs underwent hemilaminectomy, while the remaining 35% had a mini hemilaminectomy. Out of the total cases, 12 dogs had a PO and 5 had a NO. The MRI studies were performed in dorsal recumbence, with a minimum of 2 DT2W pre-contrast images in sagittal and transverse planes through the region of interest in all cases. No intravenous contrast medium was administered except in 1 preoperative MRI case. Good to excellent interobserver intraclass correlation coefficients were observed preoperatively for the sum of areas of extradural material and postoperatively for the SE area at the slice of maximal compression in the sum of areas of residual extradural material. Residual extradural material was found in all the cases with a mean volume of preoperative extradural material at 210.5 plus or minus 144.6 cubic millimeters, and a mean VREM on the entire population was 55.5 plus or minus 24.8 cubic millimeters. No significant difference was observed in mean VREM between outcome groups. Mean preoperative maximal SC compression on the entire population was 51.4 plus or minus 16.3% of the normal SC area, evaluated on the closest normal intervertebral disc space. No significant difference was found in mean preoperative SC compression, mean RSCC, or mean SC decompression between outcome groups. The mean length of the CSF column attenuation for all cases was 4.3 plus or minus 2.1 centimeters, corresponding to 2.9 plus or minus 1.6 times the vertebral body length of L2. No statistically significant correlation was found between preoperative length of SC hyperintensities, the CSA of the SC hyperintensity, nor the length of CSF column attenuation and the outcome. Neurological outcome did not significantly differ according to patient age, body weight, or surgical technique. The post-hoc power analyses demonstrated very good power for ICCs and weak power for all correlations tested in the study. Going through the discussion. In our study, we aim to investigate the residual extradural material and spinal cord SE compression in dogs undergoing decompressive surgery for intervertebral disc extrusion, IVDE, and their correlation with neurological outcome. The results showed that residual, extradural material was present in all cases and represented a significant volume of the preoperative extradural material volume. The volume of residual extradural material did not systematically result in a greater residual SE compression. This indicates that the distribution of extradural material may be as important as the volume itself in determining the level of SE compression. Additionally, the degree of SE compression was relative to the patient's weight and the region of the vertebral column affected. However, there was no significant difference in SE compression between dogs with positive and negative outcomes, which may be due to the incomplete assessment of SE injuries secondary to IVDE with standard MRI. Furthermore, immediate postoperative SE compression may not be representative of long-term SE compression. Other factors can induce progressive alterations of the SE shape and compression over time after IVDE surgeries. Prior studies suggested a cutoff value of less than 15% of residual SE compression to determine the satisfactory outcome of the surgery. In our population, only 2 cases had a residual SE compression below 15%, and these 2 cases had a positive outcome. Using this threshold value in our population would have had a specificity of 100%, but sensitivity only 20%. Therefore, we advise using this threshold value with caution. In cases of myelomalacia, functional consequences are irreversible. Several studies concluded that the length and cross-sectional area of the SET2W hyperintensity can be used to predict the long-term functional outcome in dogs postoperatively. However, there was no significant difference in the length or cross-sectional area of the SET2W hyperintensity between dogs with positive and negative outcomes. Our results suggest that there was no bias induced by the length or cross-sectional area of the SET2W hyperintensities. Although different imaging modalities, inclusion criteria, and criteria to measure residual extradural material may play a role in the variability of residual extradural material volume and prevalence, the presence of residual extradural material following decompressive surgery for IVDE is common. Moreover, all cases in our study had residual extradural material, which represented a significant volume of the preoperative extradural material volume. In conclusion, this study shows that the presence of residual extradural material following decompressive surgery for IVDE is generally common and may not significantly correlate with neurological outcome, which suggests the limited use of immediate postoperative MRI. However, the use of postoperative MRI may still be justified when patient outcomes are unsatisfactory or to evaluate SE compression at the surgeon's discretion. Further studies with larger sample sizes and longer follow-up times may provide more conclusive evidence on the role of residual extradural material and SE compression in the prognosis of dogs with IVDE.